Hello everyone, my name is Mei Theng and I am a young mother living with HER2-positive breast cancer. On December 12, 2019, I found a lump in my left breast. I was 34 years old at that time and was still breastfeeding my little girl who had just turned 3 years old. I immediately sought medical attention. And on December 18, 2019, Dr. Ng confirmed that the lump is a cancer. I spent the year of 2020 up to April 2021 receiving treatments for my HER2-positive breast cancer, including a lumpectomy surgery, chemotherapy, radiotherapy, and targeted immunotherapy. My breast cancer diagnosis has opened up a new journey of self-discovery. In conjunction with this year's Breast Cancer Awareness Month, I would like to continue to share my story, to raise the awareness that young women can be diagnosed with breast cancer while breastfeeding.
大家上午好，我是蔡子，欢迎收看由 Sunway Medical Center 所呈现的谈心聊医。而每年的10月也被定为 Breast Cancer Awareness Month 世界乳腺癌防治月，是为了教育人们关于乳腺癌的知识，包括早期识别以及乳腺癌有关的症状。乳癌是女性最常见的癌症，在大马每20位女性当中就有1名被诊断患上乳癌。但是如果及早发现，第一期的乳癌患者治愈率更是高达98%以上。患乳腺癌的风险会随着年龄增长而增加。在马来西亚，40岁或以上的女性、未曾生育者、有家族史、不曾 breastfeeding 的女性，患上乳癌的几率也会比较高。我们今天的嘉宾有一点特别，她今年才36岁，有一名女儿，没有家族史 ，breastfeeding 超过37个月，但是在2年前却被诊断患上 HER2-positive breast cancer. Alright, Mei Theng, good morning.
Good morning.
How are you doing?
Really excited actually.
Pretty excited, that's good. I was worried that you might be nervous.
Okay, excited plus a little bit of nervous.
No lah. Well, especially you have someone sit next to you. May I know who is he?
My husband.
Oh, okay. 你好 Can I speak Mandarin with you?
可以，没问题。
好，怎么称呼你？
你可以叫我志远。
志远。好美的名字。
志向很长远，很高远。
志向很长远，很高远。然后他的名字是美婷。
对。
就是当你遇到她的美之后，就停留在她身上。
对。只是我以前我们有，他就是头我是想，我和他讲我的名字的时候，就想我的志向很高很远，但是他就回我一句，就是看到他的美之後，我就停留在他身上，我直接
你走唔甩啦。
係啦。佢可以一點樣嚟咧？佢係一個唔會咁會識講 get 嘅，唔會捉嘅。但係一下 suddenly 你咁出一句話係，呢個係未聽講嘅咩？佢唔會咁講咁嘅嘢嘅。但係就係一下 suddenly also quite short also is a happy thing that 有一個 good 啦。
It is. So it's kind of like meant to be， 即係天造之合啊。Okay，but anyway， 我哋翻我哋今日嘅話題啦。So Mei Theng, how did you find out that you have breast cancer?
It started with a lump. Actually, before I became a mother, I do occasionally do self-breast examination, but I do it really not seriously because I felt that I was young. I shouldn't have any risk. So I used to do it just for the sake of doing it, you know.
You never thought that you would have?
Yes. So on the first time after becoming a mother, intentionally touching my breast, like as in a self-breast examination, I was really surprised to find a lump which was 3 centimeters across.
3 centimeters is quite big though.
Yes, I was really surprised. I can tell you during that time I was really shocked.
Okay. I can still see that you have the shockness in your eyes. Really?
I think it was very, it's an experience that I really immersed myself into thinking about it. So sometimes when I think back, the emotion will come back.
I see. So later on, because from what I know, as you said, you are young. Even now, you're still young. When you were diagnosed with breast cancer, you were 34.
Yes, 34, and I was also still breastfeeding at that time.
Yes.
My little girl was only just, she was 3+. It was exactly 1 month after she turned 3 years old.
Right, and then so by combining all the factors, you are young, you were breastfeeding, and then do you have family history on?
No family history. What started me to check my breast again was because my aunt, who is not genetically related to me, she was diagnosed with breast cancer, but it was through a blood test. She refused to see a doctor, and upon confirmation, she passed away 2 weeks later.
At that time, you still did not know that
No.
you have breast cancer.
Yes, so that was early December of 2019, and then after that, there was one night it just suddenly struck to me that why don't I just touch my breast again, as a way to refamiliarize myself.
Yes.
Even though I was thinking at the time, I've been breastfeeding for so long, I should be already touching my breast more often.
Right.
So when I found the lump, I was wondering, how come I didn't feel it before? And at the time, of course, I was also trying to justify okay, maybe it was a blocked milk duct, but it just didn't make sense because by then I was already breastfeeding more than 36 months, and for the last 18 months I have never had engorgement, so it just felt impossible to have a blocked milk duct.
Okay.
So then
You told him.
yes, I told him.
Mm-mm.
Just needed someone to make sure that it was really there, not something on my imagination.
Yeah, right. So 嗰陣時，當佢同你講佢嘅 left breast is it 有一個 lump，
Yes.
你係咩反應啊？
maybe 我係science background 嘅，所以頭嘅時候，我哋都知道 as a 尤其是 for female breast 有時有冧啦 ，generally 冧係有時好正常嘅，水瘤啊，
係
有個
一定係
啲大啲
惡性嘅。
啊，佢唔係一定係 cancer，
係
所以講 maybe make sure 先，再然之後會 maybe 係要點樣再 check confirm 佢係咪嗰啲 cancer 係咩咧？係等開佢經期過開之後，有時嗰啲水瘤會走噶嘛，所以嘅話我哋再 check 一次。
And
also one thing, at that time we were in Ipoh.
When you found out.
Yes. So then the next day, my sister actually came to Ipoh for a visit. So my sister actually is an Opgyn trainee from Ireland.
So she just came back
No, she was-
coincidentally.
Yes.
Oh.
It's really everything happens feels so fated sometimes. So of course the next day when she came over to visit Ipoh, then I immediately showed her.
Right.
And then she told me that based on the palpation, like the way they touched, she
Right.
felt that it was movable.
Something not right.
Of course something is not right. She felt that it doesn't have the characteristic of a cancerous lump.
Oh, okay.
Yeah. So, and I also felt as it has this movable, then you think maybe it's not.
Right.
Then it was when I decided to see a breast surgeon. Then, in fact, the first time he said the same thing as my sister.
The first
That is-
breast surgeon.
Yes, first breast. So he said based on palpation, it should not be.
Okay.
However, under the ultrasound, it's different.
I see.
Yes. Then he asked me to go to the radiology department to get a second opinion. And then when he reviewed the results, then he offered me, do I want to have a fine needle biopsy the next day or wait 3 months later?
At that time, you did the diagnosis in
In
Sunway
Sunway,
Medical
yes.
Center, right?
So at that time, we haven't confirmed the diagnosis yet.
Okay, I see.
I was thinking to myself, why wait?
I see. So did you come for the diagnosis by yourself or?
No, we came together
Oh,
with
okay.
our little girl and my sister also.
Really?
And to be honest, actually initially I almost didn't come, to be honest. Because before I called Sunway Medical Center, actually I called 2 other centers.
Right.
And at the time, the first center I called, they said, the sonographer is not in immediately the afternoon.
Right.
I thought, maybe it's the first time I don't need to check.
Right.
Okay, maybe it's
Because it's like because earlier you mentioned that it sounds like everything is so fated, everything is arranged.
Yes,
So
yes,
this
yes.
time it's like okay, since I couldn't get this person, maybe I wasn't meant to meet him.
Yes.
So maybe I do not have the breast cancer. I see.
Yes.
Okay.
That's right, okay.
Just
I
kind of
called-
like
I called another I called the center and said, the breast cancer center is fully booked until the following month. Another sign. I thought another sign.
Another reason to delay, right?
Yes. And I don't know whether this is maybe becoming a mother. I didn't want to spend the money because upcoming there will be Chinese New Year. Then for married couple, Chinese New Year you have to spend a lot of money.
This is the thing I really 线上的朋友们，我告诉你们，真的，我觉得任何事情都不比你自己的身体的健康重要。农历新年过了，明年可以再庆祝，所以在任何情况、任何时间， 都是以你自己的身体健康为前提。Oh, you understand, right? So I'm just saying that it's the same thing, right? Yeah, because you can celebrate the New Year next year, Chinese New Year next year, So, okay, back to your story.
And then he told me that don't worry about the money, just go and call another center. So I finally called Sunway Medical Center.
Right.
Then at that time, actually, I didn't know about breast surgeons. But I just thought, I just told the information. I said, I need to see someone about the lump in my breast. And then he said, there are actually 2 breast surgeons that's in Sunway, but one is already on leave. So only Dr. Ng Chang was left. And then luckily, Dr. Ng Chang said I can come in immediately the afternoon.
I see. So actually it's fated that you have to come. See? 啱冇？
啱。
係嘅。所以嗰陣時佢一直同你講係唔愛睇你點樣？你咩反應啊？
At the end 我係講去睇啦，佢啲係會睇，即係有時心掛掛又變成咁樣。但係 at the end 我講係說服佢去睇 ，OK 冇問題，我哋一齊去睇咯。
That's the reason why the whole family came.
都唔係咁講嘅，因為 I mean, when you go to see a doctor, sometimes you think that it's probably nothing. Then you go there with the feeling that, after that we go somewhere else.
Oh, that was your feeling. That was your plan.
Actually, we went to
Big
Bad Wolf later.
哦，
呢時頭嗰時候去攞 result 嗰時候，
第一次睇醫生。
我第一次睇醫生。
係。
But 其實都係好時候嘅，因為你冇 came in with the worst expectation.
Yes.
You just said, no, I came in for a checkup.
但係醫生叫我做翻嘢都爆師，就嚇到咯。
哦，因為冇 prepared。
咁咯，
跟住好，當你見咗醫生啦，拎咗 result 之後，幾時拎 result 啊 ？How long?
So the next day after the first time I saw Dr. Anjay Hong was on a Monday. The next day we have a fine needle biopsy. It was on a Wednesday when we came back to review the results. And again, we actually also came with the expectation that everything's going to be fine because my parents came with me.
Also this time, which is a good thing because you were surrounded with your loved ones.
Yes, I can say so. Yeah. But then I felt that very bad for my mom because of the expectation everything's going to be fine. My mother actually followed me into Dr. Ng's clinic. So when Dr. Ng said it's cancer, all the 3 of us ladies cried. My father at that time was outside with my daughter, and he was in the office. So I think it shocked Dr. Ng to see 3 crying females in his office.
So just curious, how did Dr. Ng deliver the news to you? Broke out the news to you?
He was pretty straightforward about it. He just said it's cancer.
Which is good, right?
Yes, no beating around the bush. Yes.
So and then 3 of you
cried. The first one to recover was my sister. Probably this is a good thing because when I went for my fine needle biopsy, I didn't bring anyone of that except for my sister. And we have a little discussion about my fears, like my worries, and then I had an opportunity to voice out, that rather than keeping inside of me, and that really helped, to hear myself, saying out loud what are my fears and my worries.
What were your fears and worries?
The top of my head actually is about my fertility. Because I already know that I have infertility issue. In fact, actually both of us have. And at the time, I did thought, what will a breast cancer diagnosis mean? I asked my sister about the potential treatments that I'll be receiving, whether will it actually affect my egg reserves. Because I know that it's important to have the eggs, right? This is also because we actually conceived our little girl via IVF. So this was in 2015.
Right. You both were married in year?
2011.
2011. So it's 10 years anniversary.
Oh, and at the same time also, just to share with you, we were actually celebrating our 8th anniversary when we got this breast cancer diagnosis. It was actually smack right in the middle of the dates.
Oh, really?
Yes. So we were legally married on the December 17th, and December 19th is the day that I got married into the Wong's family.
The tea ceremony.
Yes,
the tea ceremony, understand.
And my breast cancer diagnosis was smack right on December 18th. So I think by the time...
So there's a lot of
emotions
going on in your mind.
Because you're celebrating anniversary, you're thinking, we are going to have many, many years ahead. You're celebrating your love, right? Then all of a sudden you have someone is it's not like a cough, you know. It's really like an illness that would cause death. At the time, I think both of us also find it very hard to say. I mean, to be honest, I'm very worried about him because he tend to be the quiet one in the relationship.
I understand. So what were your worries about him?
Originally, my plan was that if everything goes well, then last year was supposed to be the year that I would maybe try again. So just to give a little bit of backstory, after having my little girl via IVF, when she was about 15 months old, I found myself unexpectedly pregnant naturally.
Okay.
So unfortunately, that ended up in a miscarriage around Mother's Day. So I always carry this hope in me that I want to try again. You know, I never intended to have only one child.
I understand.
So I thought that maybe I've given myself time to nurture or nourish my body, then I would then try last year, and that was the plan. That if it doesn't work naturally, then we will try to. I would actually propose to him to try IVF.
Understand.
Yes.
So when breast cancer came into play, that actually was not the thing that feared you most. What feared you most is that you potentially you're not able to have the second child.
Yes. And
so
maybe
what?
sometimes this also because when Dr. Ng confirmed that it was breast cancer, then he actually wanted to arrange for me to have a surgery around I think 2 days later. Then my sister, she got over the shock the first one, and she said, wait, my sister is very concerned about her fertility. And like I said, also it fated because I was like in my day 3 or day 4 of my menstrual cycle, and it was the right time to enter into an IVF program straight away. So luckily, Dr. Ng immediately called his colleague from the fertility center and asked him to wait for me because actually it was already 5 p.m. at the time.
Oh.
Yeah, so I rushed down, and he was still in office. So when I went to see Dr. Kanapan from the fertility center, after discussing with him, because there was an issue that we didn't know whether my breast cancer is a hormone receptor positive or not. And in the IVF program, they actually use hormone to stimulate the eggs into maturation. I'm not sure what, I can't remember any changes that he made, but my sister and him actually had a discussion. So immediately, without even seeing him, I told him, okay, I want to do this. I want to go through the IVF program and keep my embryos for the future.
When you made this decision, did you know?
He wasn't there yet. He wasn't at the hospital yet, but he has heard over the phone from Dr. Ng that I have a breast cancer.
So let's take a step back a bit. So 當佢幾時同你講佢真係診斷有呢個？
我記得嗰時候就係咁，我翻緊工，我喺 office，suddenly 係我收到電話啦，因為我啲知嗰日佢哋我嘅姨仔同佢即係成個 family 會去睇醫生，即時會攞報告啦。我啲 accepted， 因為冇事嘅，因為係知我 even 我係因為 science background 嘅係。even 我啲係以前做過即時幫一個 cancer society 做過工。我喺 hospital 入邊做，我啲知道係嗰個 in terms of cancer， 我啲了解有少少，所以我變成翻呢個有水瘤，好多時候有咁嘅一個瘤，好大機會好多時候唔係 cancer， 但係變成翻我收到佢電話，然之後去。
你當時候係咩心情？
我講唔出。
我哋佢講 OK， 你等一下，去 pass 電話俾 Dr. Ng。
我嗰陣時你係講唔出説話嘅。
所以嗰時候佢同我講，然後Dr. Ng同我講，Mei Theng有 cancer，breast cancer。所以呢個時候我啲有時啱係同Dr. Ng傾緊啦，我就睇一個有時係有理智啲，因為我經過知道 what is breast cancer， 所以問佢第幾期，佢嘅時候 suspect 係頭一期咁 OK 咯。因為一下突然嚟嘅時候，我啲好似因為
呆咗一下，
我啲 OK，get the message。After that 電話冚開，我睇樣嘢做嘅就係，因為我以前我係做嗰份research 㗎，尤其是 cancer research， 我睇一樣 internet 我就 search。What is the survival rate of breast cancer？
嗰陣時你揾到嘅答案係
成80至90%以上嘅。
Which is
OK 啦，但係我係有理性嘅，因為我知道 breast cancer 80至90係好高，但係你唔好忘記20至10
can happen。
Yes， 所以變成翻啲係still over the shot， 但係翻緊工，你係冇啦，你係開始有嗰個嘢喺度煩惱，喺度諗咯。然之後 anyhow 啲係到開夜嘅時候，因為佢嗰時候仲要喺 hospital 入邊又要即是嗰個 fertility 嗰度做，開始要做好多啲 process 嗰啲嘢，我咪過嚟呢度去 meet 佢哋咯。
所以佢講佢頭先講佢冇通知到你啊嘛，
係啊，
做嗰個 IVF，
佢冇啊。
到最後你
到最後我知道嘅時候，佢已經開始攞藥，即是已經係 regret， 即是 in that program 咗。我啲講，做咩？因為嗰時候 hospital 嘛，啲冇咩問咁多，但係翻到去嘅時候，做咩你要做咁嘅咩啊？不如講係即時 facing 面對呢個問題
after another，
yes， 但佢講呢個嘢 not negotiable， 所以我變成翻 OK。但係 after that 我聽佢明翻佢講嘅係，因為點樣去咁做咧？因為可以講係。之後如果做咗 treatment， 我都知有時做開 chemo 好 radio 又好 even 嗰個 treatment 係有時1年2年，再影響再遲啲再影響嗰個 in terms of whether 可唔可以 pregnancy 或者對胎又唔有害，又要等咗俾你 quality of the egg 會好耐，變成翻依家去30幾係好後生，但係再經過啲 treatment chemo 嘅時候，如果再40歲或者再40幾歲嘅時候，再個時候嘅 egg quality 幾時都唔好過依家嘅，所以變成翻，我覺得掉翻轉頭我可以諗係，你嘅決定係啱嘅。然之後，
我覺得同佢講一樣嘢，唔想 regret。
啱，
因為
你唔想 regret 係。
如果我真係捱到呢個 cancer treatment 啦，我唔想到時先知，原來我冇做開個準備功夫去 prepare 我自己 for the future。因為because 我哋經歷開個 IVF 第一次係咪？我有 realize 一樣嘢嘅，點樣講？嗱，when I started on the first IVF program, I was only 30 years old. However, the doctor did tell me something. I didn't respond as well as other 30 years old. So sometimes younger age, it can be also not be a good factor. I mean, not a promising factor. And the other thing I realized, the general public will know that the IVF program is not a small sum of money, right? But having gone through life experiences, I also realized there are really things that money cannot buy. You know, the time that has passed, you cannot buy that back. You know, and you know, because we are born with the amount of eggs in our life already. If I lost that, I can't buy that too.
I understand.
So I told him that I just don't want to regret, and then he understood.
So, through our conversation, I really can tell that you both really love children.
Actually, I would say that I'm not a naturally children-loving person, but you know, as a woman, I believe that women should have the rights to their reproductive planning. You know, how they plan whether they want to have children or how many they want. And I feel that a lot for myself, actually, it also depends on who you are with. So when I
真係我想講嗰個 meant to be 咯，天造之合喎。
因為我覺得有時候嗰身邊嘅人都好重要，特別覺得你自己愛唔愛去you know go through 個 pregnancy 啊，因為生細路哥其實都有 risk， 啱冇？咁我都記得有啲幾個時候咧佢有做開啲嘢啦，但我覺得我好想做佢係一個 father。我覺得如果佢唔係一個 father，好似浪費咗啦。我覺得。
OK。
因為以前我哋做 IVF 嗰時候，我哋有一個 counselling session 嘅，跟住我記得嘅話，係傾下之後，係睇翻嗰個 note 就係講你係30歲咋？我嗰陣我同一個40幾歲嘅人講話，佢講因為好似好多壓力啊，佢講我俾我自己，我都覺得因為係就係大我7歲。
This is okay。
但係我會覺得好似係再老啲嘅話，我驚佢照顧唔到細路哥。
But nevertheless, he is a good father, right?
He has proven himself to be a very good one.
Okay. Alright. After you have started the IVF procedure, so when exactly you start your surgery or lumpectomy, right?
we scheduled it on the 6th of January. So after Dr. Kanafas had retrieved my eggs, and then I have a short break because I was still breastfeeding. So I have to stop breastfeeding. Dr. Ng told me that even though the lump was only in one breast, I cannot feed her from the other side because any milk that is still present in the breast would complicate the surgery. So actually, on the day of my diagnosis, the night itself, I stopped breastfeeding, and it really wasn't easy.
Yes, I can imagine because after 36 plus months.
Yes, she has been so used to it.
Yes.
And I guess in a way, we also didn't prepare. To me, it was quite a sudden decision to stop. I was feeling obviously shocked over the cancer diagnosis, and yet I'm supposed to maintain this calmness, serenity just for so that I can have better IVF outcomes. So for myself, it was really a big struggle. Then I felt that I was too traumatized to continue breastfeeding. So really, it was unplanned, and then I told him that I want to stop. So that night was considered a bit of hell because my girl, until that age, she still wakes up for breastfeeding.
I see.
And one thing also, my girl is pretty observant. Okay, I did tell her why I'm going to see the doctor, so I let her touch my breast. So she knows that one of my breasts has a lump and therefore it's sick.
Right,
Okay.
of course, because it's 3 years old.
Yes, understand, you know.
Yeah.
And when she was, when I told her that no, mommy doesn't want to give you anymore, then she said the other side was okay.
She said that? Did she say that?
Yeah, she would point to the other side.
Okay.
Yes. And it was really tempting to just give in and say, okay, let you drink from the others.
And then you stopped.
I know I started crying, and he took over to take care of her, you know, carry her until she falls asleep.
So how did she handle this? I mean, 3 years.
I think as a child, so 2 nights later, the next day we were more prepared, so we gave her fresh milk before she slept. And then, but the 3rd night, she was able to sleep until the next morning. But there was one thing, because I was always close to her. I'm the primary caregiver, so I'm always with her. All of a sudden, that week itself, I have to go away for my hospital visit, and I didn't want to bring her along, knowing that now it's a breast cancer diagnosis, right? So I left her at home. And I still remember when we met together for dinner, right? Sometimes she just sit on my lap, hugging me and staring into space. Yes.
Your daughter.
Yes. It's so something that I felt to me, I always remember that moment, you know. She was hugging me, and just staring. I don't know what she was thinking, but she was just staring into space.
Then, what was your thinking when you look at her staring at you?
She wasn't staring, she was just staring outside.
Outside, yeah.
But I was really afraid that how would my breast cancer diagnosis affect her psychologically? Especially upcoming when they scheduled the lumpectomy surgery on the 6th of January, it also happened to be her first day of school.
On the same day.
And I have to check into the hospital the night before. That was the first night she slept without me.
It is hard for both of you.
Very harder for him.
Yes, exactly.
Much more difficult for him actually.
So what did you do? How did you handle her? 你點樣？因為一邊你老婆入院，我做手術，另外一邊你嘅女第一日返學 ，without sleeping without her mom。
係覺得係記得係嗰日，我哋同我個女係一齊帶去入院嘅。After that, during the night time 講，我哋要返去咗，所以 definitely 啦，佢一定喊，啲冇法。喊住翻，抱住佢翻，成個路程喊住翻咯。然之後喊到翻去，未 continue 講媽咪聽日喺 hospital 要住1-2日。After that 佢梗係唔開心嘅咯，佢 continue 喊，幫佢換開衫，瞓覺衫，佢喊 continue 喊，係我抱住佢瞓，
成晚
抱住瞓成晚，係抱到佢可以講係。佢係喊到攰，但係你知咯，抱住佢喺度行嚟行去，佢就喺度喊到佢瞓開。如果瞓到比較冧嘅話，淨放佢落去咯。但係你啲知唔係容易咯。但係變成翻，我哋都明白佢嘅心情嘅。佢係要阿媽陪住佢，甚至啲阿媽唔喺度，
就係第一日返學。
但係第一日返學，聽日嘅時候，佢起身咯。 起身佢 OK， 頭嘅時候佢講，因為佢起身佢都好 looking forward 去返學，但係返學開之後佢要諗到，佢啲同 school 嘅 teacher 講 ，teacher 有嚟有即時又俾翻我哋，有時佢哋講佢掛住媽咪，
尤其係睇到人哋嘅同學有媽咪送佢哋返學，
所以變成翻到聽日嘅時候，我哋再去翻嚟，因為佢係半日啫，所以半日之後再喺屋企同佢搞一下先，再遲少少 after that 我再帶翻嚟。
因為我妹有講，佢講最好就係帶佢嚟見我嗰時候咧，我已經醒開。因為佢講當我昏迷嗰時間，我個樣比較殘啲啦，會驚嚇到佢。
而且佢會諗好多嘢，因為做咩媽咪冇應我，冇反應係。咁佢 when she was in school， when she saw other classmates have moms to send them to school, what was her reaction?
Actually, we also make, even though I was fresh out of surgery, actually I also took effort to, we will say that I will sit in the car. We will still go to the school, but I will sit in the car. Then he would actually take her down to the school. So it was a compromise. And then one thing also, because of the surgery, I have to change our sleeping arrangement. So we were sleeping in the same room, but I have to change the way. Yes. And I also think she was so afraid to hug me.
Oh, she realized?
Because I was having bandages.
佢都有睇到，因為我哋係一個點樣嘅父母咧，係我俾佢哋知道，我俾個我哋嘅女知道 ，actually 係媽咪做開咩手術，所以好多時候我哋有 disclose 俾佢聽，因為有好多嘢我哋都唔想隱瞞，因為隱瞞得太。但佢明白咩？3歲細路哥，唔好講3歲啊，有好多大人啱20幾歲，你同佢講呢啲咁嘅嘢都未必明㗎。
但係嗰陣我哋覺得係唔所謂，有個 culture of secret。
I see，
未必可以講係好似
我哋嘅家教。
可以講我變成翻，我講媽咪 breast 嗰度有 germs，所以佢識咗，所以 need to take out the germs。佢頭嘅時候，佢諗到take out 咪 take out 咯，點解有咁多咩？但佢冇知道嗰個 germs 未必係 cancer 嗰種咁 serious， 但係至少佢知以為係傷風咳啦，以為知道係一個病，所以佢都會問嘅，媽咪好開未 ？Are you okay？ 因為
That would melt your heart.
Yes.
That would melt your heart. 明白。好 ，So when you did the lumpectomy, since you really want to have the second child, was there any necessary adjustment in the surgery by Dr. Ng? So you
surgery,
can...
no.
Oh, okay.
So after the surgery, then we review the results for the pathologist. I tell you, like, when I was going for the surgery, I was preparing myself for higher staging because it was 3
You were preparing for your what?
Advanced stages of cancer because it was 3 centimeters across.
Yes.
So the breast cancer staging actually depends on the lump size also.
Right. Which is you are stage 1, right?
So based on the report, it's called stage 1A. It's because when they dissected the lump, the cancer cell only occupied 1.5 centimeter.
I see.
So that's why it's called stage 1. And then A because there was no lymph node involvement. I was very scared because in my mammogram result, it was written there abnormal lymph nodes. So I was preparing myself for more advanced stages. So when Dr. Ng said, "Oh, it's stage 1A," then that's right. Yes. But the next word was like, "Oh, but it's HER2 positive, so you have to go for chemotherapy." I'm like, "Huh? What's that? You know?"
What does that mean?
Yes. Because so then that's when I realized that actually my knowledge about breast cancer is actually very superficial. I already know about maybe people will lost their breast cancer, or maybe they're stage 1, stage 2.
Which is most people. That's most people understanding as well. That's why that's the reason why we are here.
Yes. So immediately I felt that what are all these things,
Right.
And especially also I needed to explain to my parents. But luckily my sister was here, so she did most of the explaining for me.
For your mother.
Because my mother tend to be the one who is quite worry a lot.
Yeah.
Obviously, and I mean,
anything happened.
I think general public would think that only someone in the advanced stages of cancer would need chemotherapy. So suddenly, when Dr. Ng said, "I'm stage 1, but yet I need to do chemotherapy," so I mean, for the next few days, my mom also did ask me, "Actually, is it more serious than we think?" And I really don't know how to answer her, but to say that it's I will still go ahead with the treatment.
I understand. So what before before you did the chemotherapy, what was your perception about chemotherapy?
Losing hair would be one. And of course, my sister also very conveniently explained that you'll be losing all the hair on your body, not just on your head. She reminded me that. Yes.
So it's good, no need to do waxing anymore.
Yes, actually, that was the part that I loved the most. But then I was also thinking to myself, because I used to fill in my eyebrows, okay? And then I was asking myself, how would it impact me if I were to brush my teeth and then I see myself without eyebrows? And I don't have the kind of skills to draw my eyebrows from a blank space.
So what do you do?
So that so in the past, actually, he doesn't encourage me to do eyebrow embroidery, okay? And then I
But you have to give in 啦，因為病人啊嘛，一定
I
愛俾你
feel
開
like I
心
was
嘅。
preparing myself for battle actually. It's like, we put on wall paints,
Yes.
So then I got in touch with some friends and said, I know someone who can do it quite naturally. So I said, okay, I will do it. Okay, and after
Yeah,
that,
it does. That's why I couldn't tell. That's why I asked you this question.
to be honest, I should have done it more. It would save me a lot of time. And also one thing I realized, I was thinking, because I was having long hair actually at that time. And my girl was at that time, she loved to stroke my hair.
I see.
So then I was thinking to myself, Dr. Cristiano told me, she said the hair will fall in clumps. And the treatment that I received for chemotherapy will definitely cause hair fall. Then, because of the fact that I was still co-sleeping with my girl, I have thought something like this. If it falls in clump, and when I wake up and then she sees my hair on my pillow, will that actually traumatize her? That was the first thing I thought. And then the second thing was to myself. I mean, me personally, I don't really like to see myself being weak. And seeing yourself, physically change definitely will remind so much of yourself that having a very serious illness. And I felt that would really have a deep impact on my motivation to go through the treatment journey. So after I talked to the cancer nurse counselor here, and then she suggested that I can have a buzz cut. So I don't have to shave until my scalp, but just have a buzz cut. And I thought that is good. Then I talked to him and then I said, maybe for my girl, she will feel that mommy is going to the salon to have a change of hairstyle. So which is what we did. And
It's a trendy hairstyle.
And also one thing is that I don't like, I have a lot of pride in being useful to the community.
I understand.
So when I think of my hair falling down and thrown in the garbage, I feel like that is such a waste. And again, I think something is fated. I happened to saw this lot of hope, and they were collecting hair from the public.
No, it's not fated, it's everywhere. But now you will pay more attention to it.
Yes. So I was just like, okay, why don't also to show an example to my girl, I said, okay, fine. I will have a buzz cut and I will donate my hair to lot of hope. Actually, during that time, there were other customers in the salon, and I did overheard a young girl saying that, is that how you cut your hair for donation? Because I was tying my hair, little ponytails, and that's how it was done. So then she said she didn't want to, but at the time I wasn't ready to share with anyone that I was having this, But I mean, if I turn back the time, I would tell the little girl why I'm doing this.
So, back to the chemotherapy. The oncologist is Dr. Christina, right? So, did she have to do adjustment on your treatment in order for you to get pregnant again in the future?
Yes, I did receive an injection to protect my ovaries from the effect of chemos.
Actually, this one whoever means that lady would like to in future want to plan for the
如果你之後
嘅話，你可以最好係食嗰個 drug 嘅。有好多時係打嗰隻 drug 嘅，所以未必有好多時候我哋唔知道，係啱啱好都係我嘅醫仔 sister in law to mention，你可以食，因為至少係 is a protection for our
可能因為佢個 background 係婦科啦，所以佢比較了解咯。
明白，所以佢哋就Dr. Christina 就要 make adjustment，so in the future 你係懷孕係冇問題嘅。
我哋
唔係講懷冇問題，係一個 protection 一個最好一個保護先咯。
明白。所以 will not impact 你嘅 future pregnancy 啦，最至少啦，
減到
最低啦嗰個 risk。好，咁你做呢個 chemo 係做幾耐啊？
So I have 6 cycles of chemotherapy, one every 3 weeks. and I have 2 different chemotherapy drugs.
Mm.
And then halfway through my chemotherapy, I will also start something called targeted immunotherapy. This is because of the HER2 positive breast cancer. And that one will be done for 18 cycles, same thing, once every 3 weeks.
I see. So any side effects of the immunotherapy?
Especially I think more on the chemotherapy, because I started with that. So the first chemotherapy drug I had actually affects my appetite. Because sometimes during the treatment itself, I can feel my mouth, the cells in my mouth, my throat. I feel that there's a bit of change.
Oh,
yes,
did you tell Dr. Christina about it?
But I do understand that because that drug actually affects that. So I prepared myself by asking Dr. Christina what are the expected side effects.
Oh, upfront.
Yes.
So you are the kind of person always would like to get prepared.
Yes.
Okay, which is good. So Dr. Christina frankly tell you everything.
I always feel that knowledge empowers, and ignorance is not bliss.
That's great. That's
so,
great.
Maybe sometimes I think I scare myself also because I like to ask so much.
No, it's good. So I'm sure Dr. Christina is more than happy to answer your question.
Yes. She was very accommodating to my questions, and in fact, before the chemotherapy, I also have this concern because I have very narrow blood vessel, so I always have a very bad time even donating blood or
to find your vessel.
Yes.
So you did the chemo part.
Yes, so I have a chemo pot implanted here just a day before my chemotherapy started. And in fact, actually went and asked I did under interventional radiologist. I asked him, please describe to me what exactly you'll be doing to me step by step. So then when we
I hope they answer, right? They answer all your questions, okay.
That's one thing I really love about the doctors. I'm very happy to know that they are very accommodating to a lot of questions. I think that's very important to me. And so when we started the chemotherapy, the first one, I still remember, so he will buy me very nice lunch, and I was still able to finish at least half to almost whole meal. But that night when I had my dinner, I cannot even finish that less than a scoop of rice in soup. I don't know why, I just couldn't, no appetite. And then of course, even drinking water itself tastes a bit yucky.
Metal.
Yeah, there's a metal taste.
Wow, yeah.
Different reaction.
But then, but when you're under chemotherapy, you're supposed to consume a lot of water or liquid intake. So I tried my best.
Did you tell Dr. Christina about it?
Yeah, so she actually has an anti-nausea regimen.
Oh.
So it has, I think I had to take about 2 to 3 days of steroids. Initially, I was a bit reluctant to take steroids because of the negative things I heard about steroids. But he told me to just go ahead and take it. It will help me a lot better.
Yes,
so,
at least at the beginning stage. Yeah.
So I followed. And then I also, I tuned into my body. I asked myself, what am I craving at the time? And I realized that, it's something like when I was pregnant, I have a bit of pregnancy cravings. Then I feel that myself, I needed to drink more soap. So I actually told my family to make me noodles in soap. So then I would drink the whole thing. So they will put a lot of tomatoes to make it more appetizing. And I also so I have a craving for more juicy fruits.
Oh.
Yes.
Which is good.
Yeah, because in a way, it does help me to increase my liquid intake.
Right.
Having said that, I also experienced constipation. Even despite all the liquids I was taking and the fruits I was taking, I was still having constipation, and it was quite frustrating.
Yes, I can.
In my life, actually, I had more diarrhea than constipation, and having that few days constipation, it was quite was
unnatural or abnormal for you.
It was abnormal, and then at one point I didn't know what to do.
And it frustrates you.
And then I was just thinking, I said, why don't we try dragon fruit? Then he bought dragon fruit, and it really works.
It works,
Yes. And after that few days, so I have a chemotherapy once every 3 weeks, right? So always the first 5 to 7 days is the most the terrible days, I would say. Then the next week, Dr. Christina asked me to stay at home because my immune system will be down. So I wouldn't go anywhere at that time. But in my 3rd week, I always feel happiest because I feel more like myself.
More energy.
But the thing is
that after that 1 week, then you realize I have to go through that cycle again.
Well, this is the reason why they arranged 3 weeks for you to regain your energy and strength for the second cycle. Right? So 當你睇到佢，正話啲Mei Theng都有講咗啦，佢係 做嗰個 chemo 嗰陣時，就係有好多 side effects 嘅。其實你有觀察到佢有咩變化冇？無論係身體上啦、心理上啦，或者係情緒上。
變化一定有變化，但係
你觀察到係咩變化？因為有時佢講咧係佢自己 ，you know from by herself，she observe herself。依家如果作為佢嘅丈夫，你睇到佢最大嘅變化係咩咧？
未必可以講係放花，physically
嗰段時間physically
好冇咩變化，但係好多時候佢知道嘅一樣嘢，佢知道，因為個時候啱，尤其是前面個時候開始 treatment 個時候，佢係點樣嘅？好似正話佢都有講嘛，佢係要知道了解全部嘅嘢，然之後啱 suddenly 有一個咁嘅 cancer 出嚟，佢開始嘅時間好多係諗到點樣去 fight， 即時點樣去 fight， 點樣去安排全部佢嘅時間。係，但係佢都有講，當佢靜落嚟嘅時候，尤其是沖涼嘅時候，佢一定會喊，因為好多時候
Did you?
Yes. I think sometimes, especially in the beginning, my sisters, even my husband would say that I look very rational. The way I plan everything, well, I would go through IVF first, then my surgery, you know, like 好理智。
好理智。
Looks like I wasn't affected emotionally, but the moment that I was alone,
So you
couldn't help it anymore.
I understand. So you kind of like, you know, you're trying to build yourself a fort. Not a fort lah.
I feel that I was very objective and it's like do one step. So like ignore my emotions. I wasn't ready to handle my emotions.
所以佢不嬲都係咁嘅，從你識佢到而家。
唔係，佢係一個比較會好中意喊嘅人嚟嘅。
但係嗰段時間
有時變成翻佢係點樣咧？越戰越強。佢變成翻係當困難嚟嘅時候，佢會諗辦法去
解決。
但係係一時越睇越硬，佢就越 stand 得越夠 form 變成翻我可以睇到佢。
但係佢心 internally 其實係仲更加越脆弱嘅。
會脆弱，所以變成翻我可以做嘅係嗰時候我可以做嘅就係家庭我照顧啲，我嘅女嗰啲全部即時嘢我照顧啲，而俾佢有多啲自己嘅空間，佢會俾自己去 equip 佢自己，去儲備佢自己，去點樣去面對即時成年嘅嗰個 treatment 嗰啲咁嘅嘢咯。而我即時係身邊嘅 even 係可以講係身邊嘅人都好，我哋好想幫助佢，但係辛苦，尤其是呢啲 treatment， 病人自己正知。
係，但係佢突然間變得咁 tough， 有冇嚇親你？因為係突然間嘅轉變喎。你講佢平時好中意喊，
有時變成翻。
其實我喊
眼淺啊，唔係好中意喊眼淺啊。It's not 好中意。Yeah，你都係 realise 好似唔係幾啱嗰個字，所以個眼淺係啱嘅，係眼淺。
係有時可以講咯，當事情嚟嘅時候，佢仲勇敢過我。
I think there's a nature of a mother. I must say that. Because it's happened to my sister as well. I didn't see her cry throughout the entire treatment. She only cried in the last minute before she left. 所以你自己發覺，你自己本身有發覺你自己變 tough 咗冇嘅？
有，
你自己都知。
其實我本身係一個好 welcome challenges 嘅。因為我覺得it's only through challenges then you discover more of your strengths and weaknesses. Of course, I didn't expect that challenge to come
in this way.
In this way, you know. In fact, actually, it was during my second chemotherapy drug that I really fall, to be honest. So what happened is that my second chemotherapy drug actually affects me differently. Instead of affecting my appetite, it actually gives me joint and bone pain. So I have researched this, okay. I asked, so people always say that just joint and bone pain.
Right.
But no one actually explained how it feels. Okay? So the first time I felt that as though I was being electrocuted. Not that I've been electrocuted in real life.
You never. Yes, that was what I'm about to ask. You've never been electrocuted.
I was so aware of my body. I felt that this electric current going through my bones.
Joint, your bones.
Yes, my bones, and I would shiver, in response. I think it came when I was during lunch or something.
你有睇到佢 shiver 冇㗎？有啊。
It was really strong, especially the first time. It was unexpected and very strong. And because I'm still living with my parents, and I'm very used to be taking care of my parents and also my girl. I mean, basically, being a mother and a woman. So all of a sudden, I was trying to wash the plates, and then it was so painful that I couldn't stand. And then I turned and said, "Mommy, I cannot do it. Then I said, "It's okay." Mommy said. My mom said that you can go and have a rest. I went to my room. Actually, I felt very sad. That I couldn't take care of her. Like he's taking care of me instead. That was really low point for me.
Yeah, because you felt.
I felt useless. I felt like I was becoming a burden, And then at the time also, when I had my second chemotherapy drug, it was also MCO. So I can see everyone my girl was very active at that time. Everyone was occupied, doing household chores, being occupied with her, and I was basically doing nothing.
So you felt that, I was used to be strong. Why?
Yes. And then, but one thing good about myself is that I always try to lift myself. So, because I used to be a counselor for domestic violence women, so I know that it's so easy to fall into a dark place. But I have to put in that effort to lift myself out of that darkness. So what I did was that
How did you do it then?
I took out. So I was also searching actually. I was doing things like coloring books or paint by numbers, but I find that didn't work very well. Maybe because I wasn't naturally artistic for painting or
it would frustrate you even more because I couldn't color it well.
Yes, then I discovered knitting. So what I did was I was searching because I was also worried that the traditional needle knitting would hurt my fingers because I was having joint pains, right? Then I discovered there was something called loom knitting. So I bought the whole thing without telling him. It was quite expensive. And then I tried. And then I first made a hairband for my girl because my girl's hair was growing at that time and there was no salon.
Right.
So I thought maybe I can make a hairband for her. And after making that small project, I sort of feel like, I'm feeling better for myself. I feel kinder to myself actually.
You found calmness.
Yes, I found calmness. I feel kinder, and then I felt that I wasn't not that bad. I'm still producing something, And then
make yourself useful.
Yes, correct. And then my mom's also, because my mom is the kind of person who loves to go salon. She if you see her, right, her hair needs to be done at the salon. And because of the MCO, she was also feeling a bit disappointed with the way she was looking as MCO went on. And I make hairbands for her. So I think that really turned around, Then I became more engrossed into doing this crafting for myself. And I started bringing this to my treatments also.
I see.
And I think it really changed the way whenever I plan my outing for my treatment, right? I would bring a lot of flasks to do for the Starbucks, and I'll think, what I want to buy later for my breakfast, and then I will also bring my projects. I would bring headphones. Basically, I was going for like a retreat.
Right.
Yes.
Which is the right way to do because you need to make yourself calm, happy, joyful in order to go through the entire treatment journey. Right. 线上的朋友们好不好给美婷一个爱的 emoji 或者是一个 like 好不好
？Thank you.
好 ，So 資源我問你啊，所以當你睇到佢 go through 呢啲嘢，其實我覺得作為丈夫、作為 patient 嘅屋企人咧，其實都係有自己嘅壓力嘅。
會有自己嘅壓力嘅。
你有壓力嘅冇呢段時間？
壓力一定會有，係變成返會好多時候屋企人嘅嘢會 take care， 我要 take care 多啲，而俾佢多啲時間去做返佢自己嘅嘢。未必可以講係，尤其是響女嗰度，一個好運嘅咧，就係我係一個好 hands on 嘅父親嘅，所以講係由佢出世，我成個去坐月嘅時候係我幫我個細我個女沖涼嘅。
所以係一個好
我
事實上，所以你係一個好細心嘅父親。
然之後你可以咁講，或者係可以講係
hands on。
然之後我對我自己嘅女嘅睇法嘅要求，或者係我自己有我嘅 opinion，所以嘅話，我會自己照顧多啲。好多時候我都會同佢搞，係因為我啲知道，我想同佢搞係因為然後女大咗，變成翻我哋需要多過佢需要我哋嘛，變成翻我呢啲嘢我會做好多，而 at the same time 俾佢多啲時間休養。因為好啦，就係啱啱好運係 MCO， 我啲同佢搞笑嘅係 MCO 嘛，因為全個世界。成個慶頓嚟陪伴 Mei Theng 一齊做過。
係啊，我有朋友喺度笑啊，因為佢嗰段時間咧，佢懷孕。你講全世界陪我坐月啊，啱啱係 deliver 咗，係講全世界同我陪我坐月幾好。So OK，so 咁樣同你傾下咧，我覺得你係你應該係屬於一個好冷靜嘅人係嘛？
會冷靜，或者係可以講係
理智。
理智會係因為我有 science background， 我知道面對呢啲咁嘅嘢，可以講係以前我係喺 hospital 做，我喺醫院做，
見怪不怪。
lab 入邊係 bone marrow transplantation， 隔離係 ICU， 對面係 OT， 所以人生嗰啲嘢會睇得到，但係你知道一句嘢。
When it happened to you， 當係你最親嘅人發生喺最親嘅身上嗰陣，
未吉到肉係唔知痛嘅，所以變成翻會影響我好多啦。所以我最記得我同佢講嘅時候，有時啱係知道嘅時候，我會同佢講一句就係冇咁早走。尤其是可以講冷嘅，可以講係理智。因為我哋都知道 cancer 冇 cure 嘅，唔可以講一個 cure 字，所以喺醫學之中 cancer 咪冇一個 cure 嘅字，係變成翻可以講係當自己知道身邊嘅人有一個計時炸彈，係點樣都好有一個背後，你點樣都有一個問號喺嗰度嘅，係可以希望係。而依家最好嘅嘢係做開佢，然後照顧佢好多啲。
其實有時候咧，我覺得佢咁嘅性格啊，咁冷靜啊，我做下個 patient 我都好驚嘅啫。因為我覺得當你唔識去
表達你自己 express yourself，
係咯，其實係我覺得對佢嚟講係唔好啦。所以我佢都好記得咁，因為嗰時我有 diagnosis， 我哋係慶祝緊我哋嘅8週年，啱冇？跟住喺因為我係記得17號嘅，係記得19號嘅。咁喺當日係19號嗰日，我哋係要去做 mammogram。咁嗰日我就係冇帶女咯，啱冇？我就同佢講 Happy Anniversary。跟住我覺得可能係聽我講呢句就係一下喊落嚟你專門，我都係嚇到，不過我都好開心，因為我覺得at least 你有一個 release 啊，我 feel 到。跟住本來初我個女，我妹係咪？係本來一個開聖誕節就會翻去愛爾蘭咗嘅做工，但係因為我嘅情況係喺度諗，我唔會留低到我嘅形成開我嘅 surgery 先，因為我哋只係會知道 the real extent of the breast cancer after the surgery。所以咧嗰時候都係因為佢嗰時一刻佢有個 job 啦喺 Ireland，and then 佢上司都唔係好 encourage 佢攞長假咯。咁我就唔知點樣去 advise 我妹喎，跟住我妹就問佢嘅意見，跟住即刻佢就講。
所以嗰時候我講，真可以嗰時候，真我心情點樣咧？我同我姨仔講，叫佢唔好走，因為變成翻我自己，我唔可以 handle， 我 handle 唔到咗。尤其是係未聽嘅嘢，唔係我唔可以 handle， 我可以理智去 handle， 但係掉翻轉頭，我 feel 到，因為佢對呢件事，佢比較有理智。去 take care of Mei Theng， 於是我姨仔可以 take care of Mei Theng， 而我可以做嘅，我唔想 handle， 因為啲好 emotional， 一定會 emotional 好多 emotion。去 handle 嘅時候，我更加令佢難受，令我啲好難去再去 handle 落去。我寧願講 OK， 你去 handle， 而我 handle 我嘅女，比較照顧我個女好啲。 而我姨仔即是 take care of Mei Theng 變成翻我唔使真係自己講我負擔咁多，係我直情同佢講，我真係 handle 唔到咗。
所以我每一聽咗之後係咪？佢因為我每都同我一樣嘅，都佢好擔心佢會唔會 break down 你知冇？所以當佢一講叫佢 stay，佢就 OK， 佢冇理咁多咗就 stay 咯。
In a way, actually, you're quite lucky, you know. You're surrounded by a lot of people who loves you.
And then one thing I realized also on the days after I got my diagnosis, we were like one medical doctor and 2 scientists. We were analyzing the results actually. The way we were doing it, like we are analyzing things, we are very rational.
Right.
You know, I think sometimes I feel blessed because when you are diagnosed with cancer and you tell people about it very easily, people tell that, oh, they will offer you something else.
Right.
Because of the background that I have and the people that I have around me, I wasn't swayed by those temptations.
Right.
And I felt that really helps me a lot.
Right. And you have a team of doctors who helped you too. Besides Dr. Dr. Christina, and you also have done the radiotherapy.
Yes. So a month after completing the chemotherapy, then I start on the 15 sessions of radiotherapy. So actually, because I did have a lumpectomy, during the lumpectomy itself, I also have 1 dose of something called intraoperative radiotherapy.
I see. So how was it? I mean, how did you feel for the radiotherapy treatment?
Actually, I felt that it was okay. It was very quick actually.
Very quick compared to chemo, of course.
Yeah, very quick compared to chemo. The only thing because of the journey, because I stay in Rawang, so I have to come every day to Sunway. So at the time, I think at the time was a CMC or something. So obviously the highways were full of cars already. So there are certain days I will come by myself, and then there were certain days I will come with my parents. And I can tell you, I don't know why, when I come by myself, there will be delays. Either the machine breaks down.
Okay, please don't tell me it is because of Jing or fate.
When my parents came with me, right? My mom said the first time she came, she was ordering breakfast at dawn. When I told her that it's over, I said, "Huh, my food just arrived." You know, so when I came here with them for radiotherapy, either we finish early, or on time or early. Yeah, on time early. I was like, huh?
So how was your experience during the radiotherapy treatment?
It was pretty good actually. Everything went very fast, and I was very lucky because when I had my lumpectomy surgery,
Right.
Dr. recommended me to do something called intraoperative radiotherapy. I think it stands for
IORT.
Yes. So that actually reduces the number of sessions I needed for radiotherapy part.
Oh, I see.
Actually, I know that when we have to come to hospital so often, especially staying so far away, getting tired is one of the things that a lot of patients would feel, and I actually feel that too.
Right.
So I think it can be said as a blessing when the IORT actually replaces some of the sessions for radiotherapy. And in terms of myself, when going through radiotherapy, I was recommended to buy an aqueous cream to apply on the skin.
Okay, I understand.
So I actually take a little tube of it. I will apply every time after the session, and it actually helps me to
recover faster for the skin.
My skin wasn't badly burned. It was a bit reddish, but it wasn't like
like
badly
burn,
burned, like sunburn,
right.
you know. So I think quite lucky in that way.
I see. So back to your intention of having babies in the future. When you do the radiotherapy treatment, did you specifically tell the doctor that you?
Oh, so I think radiotherapy was just on the breast itself.
Do they have to do it very specific or very targeted area?
Targeted area.
So it won't impact you at all.
And then for me, because it's on my lump was on my left breast, so I have to do the breath hold technique. So I have to learn to hold my breath before they shoot the beam.
Right. So I would guess in the future, if you want to do any breastfeeding, will not be a problem?
I have asked Dr. about this. In fact, it told me very long before I asked. I think because so I really treasure breastfeeding. And how to say this? I was afraid of the answer.
So
but
you
also
didn't
thanks
ask.
to my little girl. So after she turned 4 last year, right, all of a sudden, I don't know why, she started being curious about brother and sisters.
Right.
Okay, and one day I was cleaning out on my sister's book. She saw the diagram of the baby inside the adult woman's womb. So she knows how a baby, should be, Then at that time she would listen to my tummy before sleeping. Is there a baby inside? I said, no, that's my stomach. Then there was one night, I don't know what happened. All of a sudden she said, "Mommy, next baby no, Nen, she said.
She said that.
Yes. Then I said, I said, why? Nen's sick, she said. At that time, she wasn't able to speak very clearly, you know.
But at least she got a concept.
Yes. I was like, what should I say? I was like, no lah. I said, actually, mommy got one more left. Then she said, no, need two, she said. Then I said, next baby will know mommy have two.
Okay. Then there's a moment you started
I started questioning also, thinking. Then it was actually on my last day of treatment. So on my last day of treatment, Dr. Christian arranged me to see Dr. Ng. So it's something I'm starting to follow up, you know. Then I decided, okay, let's just ask. And then Dr. said, yes, I can still breastfeed. Then I felt so relieved because he said that the way he did my surgery, he actually went under the nipple, but he didn't sever any of the linkage over there. So I could still breastfeed. But he said because of the radiotherapy on the breast, I may have milk supply issue.
I see.
But I was thinking to myself, because actually I'm also a breastfeeding peer counselor, so I have learned things about breastfeeding. Then I know it's okay. I don't mind breastfeeding more frequently just to satisfy my baby's demand as long as the function is still there.
Right. So it sounds like it's really important that for a patient to tell doctor what is your intention in the future, because both of you told Dr. Ng that you want to have babies in the future. So when he did the lumpectomy, he already planned not to impact.
Yes.
I see. So even during the chemotherapy, I also trying to adjust the treatment to you, right? For you. Okay. So frankly, I really enjoy my conversation with you. Through the conversation with you, I can feel that you are a young lady with full energy, strong determination, and strong will.
Thank you.
However, when you're going through all this treatment with this unexpected surprise, does it affect you mentally?
You just mentioned that I look like I have full of energy, right? So one of the things that surprised me was my energy level. I find that I couldn't push myself the way I did before. In fact, the first time I felt this was after the surgery. I was talking to my sister in the ward. All of a sudden I felt like she was talking to me and I felt like I want to fall asleep already. And then I felt that was really strange. Then I told my sister, but then she told me about something called a spoon theory. So this was actually came up as another, not a cancer patient, but another patient with an illness. But she explains it really well. So the spoons actually represent our energy level. So for example, when we wake up, maybe he has 100 spoons of energy, but I only have 20 spoons of energy. And for him, maybe it only take 1 spoon energy to brush his teeth, but it might take me 5. So then because in the beginning, I tried to push myself. I wanted to be normal. So there were times that I tried to push myself and then I nearly fainted.
What did you do at the time?
I tried to take care of my family, cooking meals.
During your chemotherapy treatment? So 你俾佢煮飯？
有時俾佢
唔俾佢煮唔得係咪？因為佢又發脾氣，仲更加影響佢嘅病情。
而我咧可以講係俾佢做翻正常嘅嘢，冇俾佢變成翻佢係病人。如果佢係病人嘅時候，永遠都諗到佢更加幫助佢做自己，俾佢有 feel 到一個 contribution 係好過一個。
我發覺到一樣嘢，當我逼我自己唞係咪？其實我更加攰啊。
understand。就你覺得自己好it's a burden of others。
仲有就係一直瞓，逼自己瞓，係真係好攰，攰到。唔係精神咯，反而瞓多而你會攰咯。
唔係 recover。
Okay, since you felt you are more tired if you sleep more, and you also couldn't do a lot of chores because of your energy level. So what do you do as a replacement?
So I took out the yarn crafting, so I did loom knitting. And also one thing I realized, actually I used to love reading. But I don't know why at that time I lost interest in reading.
Oh.
And then when I pursued this new craft, then it energized me. And another thing also I realized, so when I talk to people say, wow, you have a lot of energy. But what they don't know is that actually being in the MCO period, okay, I was really starving for people to talk to other than my family member. So people that I met, they said, wow, you being under treatment and still having a lot of energy. I said, after we stop this conversation, then you'll see me dropping.
I see.
And that still surprised me actually, because even after completing all the treatment, I am still experiencing this.
I see. So at that time, did you talk to a lot of other people besides your family members?
Yes. Once I know that I have breast cancer, I actually felt it became like a duty. So in my parents' generation, we only have $1 on each side. So actually we don't have much to compare with, right? But in my generation, I have a lot of female cousins.
I see.
A lot.
So you're close to them?
I would say some are very close, some not. But because of this breast cancer diagnosis, I felt it was a duty to inform that, hey, you know, one of your cousins has breast cancer. Now your risk factor has increased. Yes. So then when I talked to some of my older cousin sisters, they said, when they're older means they're above 40, you know, and they have never done a mammogram before. Because they said they heard that the mammogram machine will hurt their breasts.
I see. So did it hurt?
So when I had my mammogram, yes, I did feel that because of the compression, it did hurt a little bit. But to me, it was just a slight bit of discomfort for
Not
a better
really.
peace of mind. And of course, to me, because I still have milk in my breast. Every time the technician told me that, sorry, madam. Actually, I told myself, I looked at my own breast and yeah, I'm sorry also. Because when they compressed my breast, then my milk came out.
I see.
Then at that moment, actually, I told my breast that I feel sorry also for them. But then because of the way they told me of the fear they have about mammogram, I felt that, you know, I told them, no, even if it's that discomfort, it's only less than a minute. But if you give it so much peace of mind to know whether you are probably clear, you know, of any
It is much worth it.
breast cancer. So, I mean, I feel that I have to encourage them. And also because myself as being a breastfeeding peer counselor, I also feel the need to share my diagnosis, especially since I was diagnosed during breastfeeding. So of course, one of the things that we try to promote breastfeeding, we will tell them, besides the benefit of breast milk for the babies, we also tell them the benefit of breastfeeding for the mothers. And the one thing that we always highlight is that it will reduce their chances of contracting breast cancer.
Reduced.
Yes, reduce.
But not eliminate.
Yes, so I also realized one thing. So I was in my cis comfort zone thinking that because I have breastfed and for so long,
Right.
I have reduces my risk to zero.
Mm.
In fact, one of the things that people always ask me when I first tell them that I was diagnosed with breast cancer, how long did you breastfeed? So I think they were expecting me to say, oh, just 1 month.
Yes.
But I told them, no, 37 months.
They probably fall down.
They got a shock. Then I realized this is such an important message to share out. Because it is so easy to mistake any lump for, you know, or maybe it's a blocked duct, and then we will delay. You know, delay going to seeing a doctor.
I understand.
So I always tell people that, you know, if you find a lump when you're breastfeeding, it's better to seek a medical advice to confirm whether is it really breastfeeding related.
Gotcha. So, from what I know, you just did your PET scan last week.
Yes. So,
And it's all clear.
Yes, very happy to. I mean, to be honest, every time I have a PET scan, I feel very nervous.
Did you come alone or?
No, I came with him.
Okay.
Yeah, I told him. He did ask me if I want him to go, and I said yes, please.
So, which is good news. Congratulations.
Thank you.
So, after going through all these treatments, do you notice any changes of your relationship of your relationship with your husband before and after?
I know that in my mind, after I got my breast cancer diagnosis, there was this thought in my mind, I'm glad it's him next to me. The reason why I said this is because something so serious as a partner having a disease, you know, likely to be ending in death, actually can make or break a relationship. It's either you become stronger or you decided to turn away from each other. I said this because sometimes, so I have certain close friends. Some friends whom I never contact for some time actually turned out to be one of my biggest supporters. But there were also some that I expected them to support me and they just couldn't handle it. You know, so we haven't been in contact. So I realized in any relationship, this could also happen to our husband and wife relationship. You know, so I'm glad that he's a strong person. He decided to see through this with me. So I'm always very grateful for that.
你呢？你覺得經歷過呢一段治療嘅過程， 你哋嘅關係有唔有起咗變化咧？
可以講係一定係有變化，一定有變化，但係我可以講係好咗好多。有時可以經一時覺長一智，變成翻大家更加會珍惜大家。係有時可以講 because 有咁嘅經歷，正知道大家會愛大家幾多。而可以講係呢個愛情係咪可以值得考驗嘅？我覺得 yes。It also good to 一齊去共同度過一個咁嘅難關，
共同面對所有嘅難關。It's I don't know what to say. All I want to say is that I think it's a blessing to both of you. And all right, I think our show is almost comes to an end. Is there any advices or any aspirations that you would like to share with our viewers?
As a mother with a young daughter, when I got diagnosed with breast cancer, I did think of my daughter, like how this will affect her. Because now then our family history has someone with a breast cancer. I know that in the future it will affect things like insurance or even her fear, maybe she will get more regular breast screening because of me, And then I start to think about what kind of example will I want to present to her. So I always feel that this is what I'm leaving my legacy to her. I want her to, how to say this, maybe coming back about 2 months ago, all of a sudden she was started crying before bedtime. I said, what's happened? She said, I suddenly thought of you going to the hospital and become sad. I said, why? Mommy is not going to hospital so often anymore. And then she said, when you have that germs in you, she said, then she asked me, Mommy, what if I also have that germs?
How old was she?
It was just 2 months ago.
5.
So almost 5. Yes. I was really surprised. And then I told her, okay, so I didn't want to give her any false hope. So I said, okay, Mommy doesn't know if you will ever get the same germ as Mommy. But I hope that when you do, we would face it together bravely. And I feel that, and then she said, oh, she's not. Then I feel that this is what I want to do, I want to lead by example. If I go through my cancer diagnosis or the treatments in fear, then she will also remember this moment of me, being fearful in this time. And then she herself will then have that fear in her. But if she sees me, going through my whole cancer treatment journey, how I manage myself, I am very honest with her. There are times I'll be angry, there are times I'll be very sad. I actually told her, and then that's how she will learn from me, And lately, I did a very funny thing. Sometimes she sees me very frustrated. She'll be like, Mommy, relax. She's like my therapist now, Yes. But that is the good thing. I think sometimes I always believe that we are parents who lead by example, and this is how our children can learn. And at the same time also, I know, like for example, it's the same way also, because of me, my sister is also experiencing more regular screening, and I also hope that how I face through this will also give her inspiration.
Right.
Same goes to all my other cousins, and actually we have a lot of female nieces also. So I hope that by presenting myself, by sharing with them how I bravely conquer my fears, it will also inspire them when they have their own challenges in the future.
And I must say, you definitely is giving a great example to all the cancer fighters there.
Thank you.
All right, thank you so much, Mei Theng and Jian. Thank you for sharing your wonderful story with us. And perhaps thank you so much for your time. And last but not least, all the best. And may the health and happiness be both of you.
Thank you.
粉红丝带是一个标志，但也是一种提醒，一种关爱。支持乳癌防治运动是一个简单的举动，但是对于姐姐妹妹们来说，却是无限的关爱和鼓励。我们常说，现代的女性都能顶起半边天，左手抱着婴儿，右手对着电脑打字，但是也因为忙碌的生活，却忘了多爱自己，忘了多多检查自己的身体。记得，乳癌虽然是女性最常见的癌症，但是如果能够及早发现，第一期乳癌患者的治愈率是可以高达98%以上。 很可惜的，不幸的是，处于第4期的病患存活率却只有28%。所以，及早预防、及早发现、及早治疗很重要。今天我们的节目就到这里，谢谢您的收看，记得关注Sunway Medical Center 的面子书。下一期同样的时间、同样的平台，我们线上再会。
To lower breast cancer risk, the main things are few lah. You should breastfeed more than 6 months. You should have babies or get pregnant before the age of 35. Have more kids if you can. Don't take HRT, hormone replacement therapy. So basically all those things are to reduce your exposure of estrogen to the breast tissue. But obviously, not all breast cancer are due to estrogen, so there are still others that's not. So what we can do is to do that, to reduce the risk. The main thing, how you want to improve your survival of breast cancer is to detect the cancer earlier.
Normally we'll say, you check your breast when you are 30 years old or 40 years old and above. Go for your mammogram, ultrasound at a certain age. But I think with someone who has a very strong family history, they should probably do it a lot earlier. So for example, in Ms. Ng's daughter, certainly we would recommend that she does the test, when she's 20 years old and above already. Just do self-examination first. Even I tell patients that even if you're stage 4, doesn't mean that there's no hope. There's always hope. Of course, we try not to treat patient in stage 4. We rather treat you in stage 1 to stage 3. So no matter what, we still encourage people to get screening done so that we can detect you early.